Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. We're going to be talking about a number of interesting issues. One of them has to do with what we can learn from snails, which I really like, and the other has to do with some recent polling about universal health care. Anyway, but before we get to that, down below in the YouTube description box, you'll find a link or a URL address for the Healthcare Advocacy newsletter that is the text for today's video. And of course, if you put that into your browser, you can go there and sign up for free and get this kind of stuff delivered as an email into your inbox every day. So let's get started. The first thing I want to talk about are Affordable Care Act fraudulent signups. Federal investigators have now blocked 2 private sector enrollment websites from accessing consumer information through the Federal Affordable Care Act marketplace, citing anomalous activity. The unusual step comes as the Center for Medicare and Medicaid Services is under the gun to curb unauthorized enrollment and switching of Affordable Care Act plans by rogue agents. The agency, in just the first 6 months of the year, received about 200,000 complaints about such behavior. Of course, when you complain about it, what happens is they wind up switching you back. The reason these people pull this kind of fraudulent stunt is they make a huge commission when they move somebody from one plan to another. They typically get something on the order of a 1-month premium as commission. And I don't know if you've looked at the unassisted cost for healthcare, but it's anywhere from around $1,000 a month and up per person. So there's a lot of incentive to cheat. Anyway, I'm glad to see the government cracking down, because when you cheat the government, guess what? You get to go to jail. Okay, let's talk about for-profit hospitals and what happens when they start to fail, because this is actually an extra cool story about good advocates. The San Francisco Bay Area's largest county announced plans on Wednesday of this week, so this is Thursday, yesterday, to buy a private hospital that had been slated for major cutbacks. This is a move that county officials say will preserve critical medical care. It will actually bolster critical medical care for the low-income community it serves. This is Santa Clara County in the Bay Area. They reached a tentative agreement with HCA Healthcare, the owner of Regional Medical Center, which is a huge 250-bed hospital in East San Jose, and they're going to buy the facility. The county will buy the facility for $175 million and turn it public. HCA Healthcare has been shutting down services. They closed birthing services, stroke care, the emergency department was being cut back. Does this sound familiar? Community activists rallied and lobbied for months to keep the facility open, and their elected officials heard them. The county now plans to not only restore trauma services and stroke and heart attack services, but they're going to put labor and delivery services back in there. And I got to tell you, those have been closed since 2020. So take action. It works. I want to talk about a scientific advancement. This one was kind of cool. This is what snails can teach us. Scientists are finding clues for how to treat diabetes and hormone disorders in an unexpected place. A toxin from one of the most venomous animals on the planet. There's a multinational team. It's being led by the University of Utah scientists, and of course there's a link to the University of Utah report in the story if you go to the newsletter. They identified a component in the venom of a deadly marine cone snail, the geography cone, that mimics the human hormone called somatostatin. Somatostatin regulates the level of blood sugar and various other hormones in the body. The hormone-like toxin-specific long-lasting effects help the snail hunt its prey, and it could also help scientists design better drugs for people with diabetes or hormone disorders, conditions that can be serious, sometimes fatal. The results are published in the peer-reviewed journal Nature Communications, August 20th, so just this week. And of course, there's a link to the published article. You can go read it. The cool part is they're learning how to take the snail's venom and make sure that new drugs they make will be long-lasting and will not dissipate quickly in the body. That's going to be the key to making new medicines. Anyway, for those of you that think you're going to go get one of these snails and play with the toxin, don't do it. The toxin is not suitable for human use. You'll poison yourself. But this is a good signpost on how you can get to a cure for things like diabetes. So this is really encouraging news. I want to give you some more encouraging news. Americans want universal health care, and it's not just me who says this. It turns out that from July 26th to July 29th of this year, just last month, a corporation, a survey corporation called Data for Progress, what they do is they do polling. They conducted a survey of 1,156 U.S. likely voters in Arizona, Georgia, Nevada, Michigan, Pennsylvania, and Wisconsin. Now, those are the big battleground states. They're pretty well divided between Republican and Democratic. And let me give credit to this, to the Health Justice Monitor. There's a link to their site in here, and especially to Dr. Don McCann, who makes sure that that site works. Here are some of the results from those background states. One of the questions was, do you support or oppose establishing a Medicare for all, universal, single-payer healthcare system? Get this. Those that support it, now 85% of Democrats said yes, 41% of Republicans said yes. Opposing it, 7% of Democrats and 45% of Republicans. That support level, that's way more than 50% of the population. Here's another one. Do you support or oppose cutting the cost of prescription drugs in half? 89% of Democrats said they support it. 79% of Republicans said they support it. The reason they asked that question is that in the Universal Health Care Bill in Congress, H.R. 3421, Pramila Jayapal's bill, the government would be responsible for paying for all prescriptions. They would negotiate all prescriptions, and they'd be able to cut all those rates down. Okay, last question. Do you support or oppose eliminating medical debt? Get this one. 77% of Democrats said yes. 52% of Republicans said yes. Of course, with universal health care, we won't have medical debt. I got to tell you, this kind of data that constituents want this needs to go right under the noses of our elected representatives. So let's take an action to do that. You can call or email your senators and members of Congress. I'll put a link in the YouTube description box, and you can do that and just tell them about the survey. Or use my favorite way, ResistBot. And what you can do is you can send a text message to 50409 from your cell phone. Here's the message. Sign, S-I-G-N, space, PXOJBO. That's sign, space, PXOJBO to 50409. And here's what you'll say. I'm your constituent, and I want you to know that a significant majority of voters in battleground states favor universal health care, lowering drug prices, and having a system with no medical debt. And here's a link to the survey results for you and your office to review. It's really important to put that stuff in for them so they know that this isn't BS. I expect you to take this to heart and act accordingly. H.R. 3421, the vastly improved Medicare for All Act, covers all of us. Cradle to grave, it lowers prescription costs by negotiating all drug prices and has no medical debt for anybody. The 2020 CBO analysis said it would save a minimum of $400 billion each and every year. And of course, there's a link to their report. We sent you to Congress to help us. Your constituents want this, and I want you to support universal health care like H.R. 3421 and get it to a vote. If you want to keep getting elected, listen to your constituents. That's what I've got for you. Down below, you can like, share, subscribe. Send me comments. I will answer as quickly as I can. You can also shoot me an email at healthcareadvocacy1@gmail.com. If you have a research topic you'd like looked into, let me know. I'm happy to do it. That's it. Have a great day.